what is a clinical pharmacist? It's a really important question.
That is a good question, isn't it? So clinical pharmacists are essentially we're healthcare professionals. We work in general practice and we're basically specialists in medicines and long-term conditions. So, different clinical pharmacists have a different area of expertise. So it could be, for example, respiratory, asthma, type 2 diabetes, arthritis, blood pressure management, all those kind of chronic long-term conditions. We're trained to manage those, as well as your usual prescription queries and medication advice, medication reviews. Essentially, that's what a clinical pharmacist is. It's kind of a new role, fairly new role. But yeah, I think there's a lot more recruitment happening in this field now.
And you guys work within PCNs, don't you? Do you want to explain what PCNs are?
Yeah, so PCN stands for Primary Care Network. So essentially, it's like a group of GP practices, and it's kind of divided up into localities. So, for example, the one I work for has 9 GP practices. They all kind of work together to provide, they kind of share resources. So there's lots of allied healthcare professionals like paramedics, physiotherapists, social prescribers. So we all work together and those resources are shared amongst the practices and the PCNs. Also, we have kind of shared objectives as well, which are set by NHS England. So we all work together. We have regular meetings. For example, we got one this afternoon just to catch up with each other and see how we're all doing as a network.
That's nice. All best buddies in together.
I don't know about best buddies, but yeah.
It's nice that you've got like a few of you, because I know it's a new role, but you've got a few of you so you can come together and help each other out, can't you?
And there's a lot of strain on the NHS, as everyone knows, so it does help to alleviate the workload pressures and staffing pressures and things like that as well. So yeah, seems to be working all right so far.
Exactly. I was going to say, like within GP practices, obviously prescriptions and medications is a big part of the workload. How do you kind of help the GP practice staff, like the GPs, other clinicians, even admin sort of queries you might get?
Go ahead.
Go ahead, Sandra. I'll let you speak. I'm overtaking this.
So we do, I feel like we do quite a fair bit actually, and sometimes it can be challenging because that's kind of the role that they want to box you in. As a pharmacist, I'll just do the prescriptions. But as Abbas was saying, obviously we can offer a lot more with our expertise when it comes to medicines rather than just issuing prescriptions. But I think it depends really on your practice, but what we encourage our pharmacists to do is to speak to the kind of practice manager along with the lead GP and just see what kind of they need in terms of prescriptions. And we just say try to have an equal amount of time doing clinical work and prescriptions, kind of 50-50. But we tend to, for me, I'll just have a folder called Pharmacy Hub on System 1, our kind of electronic system, and they just send kind of all the prescription queries they get, any acute prescriptions, any prescriptions that have reached their date of medication review and kind of need us to authorize it. So I do feel like it takes so much work off the doctors, and in my experience, they've always felt it when kind of we've extended our, for me, for example, we were just doing it Monday and Tuesday, and then we extended it till the end of the week because we just kind of spread out our time a little bit more, and doctors are very grateful for that.
We do feel it when you guys are not around, I have to tell you. Because in our practice, a lot of our GPs is so useful. Like if you've got a query, if you're not sure about something, it's just nice to just go to that person and say, look, I'm a bit stuck with this. What do I need to do? And you're just there at hand rather than having to go around in circles trying to figure out who to go to and who the best person is to ask. So it is definitely really useful. So I've got a question for you guys. Did you always want to become a clinical pharmacist?
Well,
wants to go first?
when I got into pharmacy, I don't think clinical pharmacist existed, the role. So no, I didn't always want to be a clinical pharmacist, but well, I kind of got into the kind of medical side of things because of family pressures, being Asian.
Of course.
My father's a doctor himself, so he kind of always had that pressure from him. But luckily, my brother ended up being a doctor. So I was always interested in like other stuff, non-science stuff. But
Oh, tell us what were you interested in?
I really wanted to be a film director.
Wow.
Yeah. At one point, I was begging my parents to send me to India to film school.
That's so random. Why India?
But but now I'm a pharmacist. But no, I was always interested in business. So I thought pharmacy was a good, I know some people who have got their own pharmacies and they're making quite good money. So I thought it's a good career, it's a good business, thing, potential, I guess. But yeah, when I qualified, the NHS took away contracts to open up your own pharmacy. So that plan went out the window. But there's always opportunities coming up, and I do really enjoy my job. And that's me.
And Sandra?
So public confession, actually, I used to study medicine at King's. I studied it for like 2 years, didn't like it, wasn't very good at it, just really didn't enjoy the course. So the other option for me was all my A levels, all my GCSE, everything was science based because that's what I liked, that's what I was good at. Again, don't really have much of a chance when you're like ethnic to think about other interests outside of science. So I don't know, had I explored things, where I would be or what I would be doing, but I genuinely did love science. So then I applied for pharmacy, and that's kind of how I ended up in my role. And I'm so grateful, I'm so thankful, kind of looking back, because it just offers a lot of, like Abbas was saying, lots of opportunities, job flexibility. Lots of pharmacists now are opening, there are other businesses such as doing aesthetic clinics. So it's a good, I think it's a really good kind of place to start now, as we are getting increasingly more opportunities.
Yeah, we do. We work with a lot of local schools in the area, and we do get questions asked about, the pharmacist role. So I think people are genuinely interested in it. And what you mentioned a few things that are quite good about the role. What is the best thing about your job?
For me personally, I think in this role, it's the chance to educate patients. So, like working in community farm, like before my background was community pharmacy when I first qualified. So, you're dispensing medicines and you're dealing with minor ailments and, over-the-counter remedies. But coming into general practice, you've got access to patient records, you've got access to their full history, their blood reports, all of that. So you can really advise, you can tailor your advice to like the patient in front of you. And yeah, as I said, educating patients, because we all, all our colleagues and ourselves, we all come from a healthcare background. So we know what everything means essentially, but these patients don't. And it's just about educating them. If they were your family members, how would you want them to be treated? So yeah, it's a lot of prevention. So we try to focus on preventing harm, preventing hospitalizations, preventing, for example, for elderly people, preventing falls. So the interventions we make with, the medication side of things, and even other just general advice where the doctors are so, they're really pressured and they don't have much time. Whereas we've got that little bit more time in our appointments, so we can just speak to them more on a personal level. And that's what I find most rewarding, because you see the improvements in patient outcomes, and even just things like that. Little changes make a big difference, I think.
Yeah, definitely.
Yeah, it's just even being told kind of by a patient, like, oh, like, I'm so thankful that you've just given me this time, you've been so helpful. And you just think, oh, I mean, all I've done is just ask you the questions that I ask every other patient. But I think sometimes I believe part of the therapy and actually getting patients better is just giving them a chance to talk. That in itself is therapeutic. So yeah, that's one of my favorite things, just knowing I've got a bit more time, can explore things a little bit more. And you do pick up on things that the doctors have no way of picking up on, because what can you do in 10 minutes? It's not really fair on them. So it's good that patients have another chance, I think.
Definitely. And I guess, like you were saying, you can follow up with those patients as well, because you have them, you have a list of patients and you've got them on in one place. And what I wouldn't say what's the worst thing, but what could be better about the role?
Well, Sandra and I were both like the senior pharmacists for our patch. So we have a team of pharmacists and pharmacy technicians working for us. For me personally, I don't enjoy too much for example, when someone's off sick, or like appraisals, the management side of the paperwork side of things. I'm not a big fan of that, but obviously it has to be done, and but that's probably my least favorite part of the job. Yeah, I don't know about Sandra, but
sorry, I'm just looking for a plug for my laptop. But I do have an answer. For me, I think my biggest struggle is just the lack of, I think, awareness of what our role is, like whether it's like colleagues not really understanding or patients not really understanding. I feel like I spend like sometimes a good part of my consultations just explaining to patients, I'm a pharmacist working in the surgery, not in the pharmacy. And then they're like very confused by that. So I wish there was kind of more public health kind of awareness. I think that would make a huge difference. And then you wouldn't have to spend so much time almost feeling like you have to gain their trust and make them believe that you can kind of make some of the decisions that you're making about their health and their care. Yeah,
definitely. And kind of future in the future. So sorry, if anyone has any questions, feel free to put them in the chat box on YouTube and we'll ask away. But I was going to ask you guys, what do you kind of want to do in the future? So where do you kind of see yourself progressing? Or you're like you're both senior clinical pharmacists, so you're already kind of up there. But I don't know where do you see yourself going? I don't know. Bas might say he might be off to India to go make a movie or something. But
yeah, basically just follow my passion.
Yeah.
No, I don't really know. I mean, I'm kind of go with the flow type of person. As I said, opportunities always come up, and it's just about how to progress as in yourself and your career and everything. I don't know.
All right.
I don't have a fixed, I want to be this person in X amount of years. I don't know.
Right, we know Abbas is running off to India soon then.
Stop saying that.
Secret plan. For me, I like short-term goal. I want to get my prescribing done. I'm hoping to apply next month. So that will be kind of another 9 months of my life gone on studying. But that's one thing I definitely want to do. I've always been interested in teaching. I don't really know how to go about it, but I've always been interested in kind of potentially doing some sort of lecturing. So yeah.
Sounds fun.
Just touching on that, Sandra's point, so we can actually prescribe, I didn't mention that earlier, so we can prescribe any medication. So just like any other doctor or anyone can prescribe, we can, once we've done the training and been to university and done that extra bit of studying, then we can then prescribe in the NHS or privately. Just another side point for anyone.
Yeah. I think, do you guys get a lot of patients kind of saying, oh, you're a clinical pharmacist, I just want to speak to a GP, and not knowing, like I think you were saying about the raising awareness, maybe they don't know about your role, and they think, oh, it's medication review, usually my GP does that with me or something. Do you guys get that?
For me, I've definitely noticed a shift in behavior, so from patients. So when I started 3 years ago, I got that a lot more than I get that now. I hardly ever get that now, actually. I think now there is more awareness in the public, and there are NHS resources and stuff, but again, they need to be circulated more widely. But if it's we're also good at realizing our scope of practice, and then if there's something very complex or it's like a diagnosis that needs to be made, then we ourselves refer to a doctor. So it's not like we just try to do the job of a doctor. It's just whatever we're competent in doing, and then then you refer on. But in answer to your question, I don't get that much anymore from patients personally, but maybe it's because I've built that rapport with them, some of them. Yeah.
It seems like you have to do it kind of almost one patient at a time, to educate kind of on kind of what we're able to do. But just the other day I recommended kind of changing patient's medication, and he just went silent, and he goes, are you able to do that, or do I need to speak to the doctor about this? And I was just like, yes, I can do it. But you do. I think that's kind of the goal, and that's, you have to be realistic that the more patients we talk to, the more kind of we're out there in the surgeries. Hopefully, they'll tell their friends, they'll tell their family, and then it will just become almost this known thing that, I spoke to my pharmacist, they did this review for me, they changed my medication, and it's just more widely accepted. I think the other issue as well sometimes is that, kind of going off what you were saying, Abbas, that sometimes because there isn't such a very clear sometimes understanding of what we can do, sometimes we can also get stuff that we shouldn't be given, and that could also, I've seen, can cause some issues, because especially, for example, a receptionist books in that patient to speak to you, and you start speaking to them and you realize, oh my gosh, they need to speak to a doctor, I don't have a clue what they're doing. That can cause some issue, because then the patient thinks, oh, this person doesn't know what they're talking about, and the doctor is like, oh, well, you don't know what you're talking about. And then so I think there's still I was just dealing with that.
I don't know what you've been doing, Sandra. Speak for yourself. Yeah. I'm joking.
But yeah, so I think we still have a little bit to go, because we need to utilize pharmacists, utilize their skills, be really kind of, I think, proud of what they can do, but at the same time not expect them to do things that they're not trained to do, because we're not F1s. And that can sometimes almost be the challenge in a very busy GP surgery. It's like you're given all the stuff and you feel like, I have to know how to handle this patient that's asking for antibiotics, when no, that's not necessarily appropriate as a pharmacist. So it can be difficult.
And do you feel like you get support from the GPs and other sort of clinicians and practice staff?
Yeah, definitely. I think personally, I've been very lucky to work with like practices and doctors and people who've always supported us. So like there's a lot of support. Everyone's always available to speak to if you need to. It's just a good team working environment. So they ask us stuff, we ask them stuff. And when you start as a clinical pharmacist in general practice, you join into an 18-month, it's a clinical pathway to train you up to be at a certain level to work. So you have to have a GP mentor anyway. So that there'll always be a GP that's mentoring you. My mentor was Dr. Mahmood from HIOS, and
love how you're doing shout outs now.
shout out. Yeah, shout out. Oh, it definitely deserves a shout out. Yeah. So yeah, very well supported.
Yeah, I'd absolutely say my experience is similar. I mean, as with everything, you're going to, kind of which doctors really want to invest in, really kind of, that's almost like their passion, because not everyone has that gift of teaching, not everyone has that gift of supervision. So you just have to be a bit smart and form good relationships with those that do almost want to take you under their wing. And it's the same, because I've worked in the hospital. There's, some doctors that, these are the doctors you approach when you have queries, and other doctors, like this, I'm not going to bother this doctor today.
That's nice. Okay, so it's 1:20. We haven't got any questions, so we'll end here. Thank you so much for joining us. And if anyone does have any questions or wants to know more, then let us know. Get in contact with us on social media. We'll kind of see what we might invite you guys back. We'll see how popular you guys are.